light? I don't know. We do. Okay. Well, good morning, everybody. Happy holiday weekend. Hopefully everyone had a great one. I'm very excited for today. We'll wait a couple minutes for people to come on, but I wanted to, first of all, thank everyone for being part of the channel in a great 2020 that we had. Somehow mentally, I'm already thinking I'm in 2021. I don't know why, but I wanted to thank everyone for being here. As I'm resetting the channel for the year, I'm looking what everyone's asking, what people want to know, what are the hot topics, and most importantly, I want to give value back. So I have a lot of information up here. I talk to a lot of people in the industry, done this for a long time. What I'm trying to do is solve what are the issues that people are having out there with these treatments. People are wondering what to do. What are the best treatments? Why aren't they seeing results? There's so many devices, options. And so that's the goal of the channel. As long as I'm bringing value to you guys, and I love the comments. It's how I learn. So by you telling me in the comments, hey, what are the problems you're seeing? Well, what are the obstacles you overcome? You can't find providers. I hear that a lot. You can't find people to do your procedures. So that's the goal of the channel. And I'm not here without all of you. So I look at it as a family. We're a family here, and we're sharing information for one end goal result. So we'll start the morning. I wanted to talk first about set up the stage, kind of like the framework for a house, because everyone's wondering what they should do, what are the treatments to do, how your provider's looking at the face. So that's the first thing to do. So I'll go into the R, and this will only take 10 minutes, but I want to start the foundation for your 2021 so you know what is it that your injector, your provider, your plastic surgeon's looking at when they're advising services or things for you to do, and how should you look at the face. So I use the R6 method. Yes, R is for Rajani, but there's method to that madness. So when you look at a face, what we're looking at, R1 is the shape. Okay, so the heart shape or the oval shape in a female, particularly more square in a male, is what your provider's looking at. So when you go and you ask for a service, they have these R6, the first 5 of them, they have it figured out in seconds. So the facial shape. Number 2, where do you look when you meet someone? Say you're going to a coffee shop where we used to be able to go, and you're meeting someone for business. What do you do, or whatever? You look at the shape. Next place is the eye. You determine if they're healthy. Okay, so that's R2. R3, the nose. I just did a video on the nose. The nose kind of just sits there, of course, unless people don't like it. It's distracting, but there you have R1, R2, R3 is the nose, R4, the lips. Why are lip fillers so popular? Even people that come in over age of 50, 60, 65, even if there's wrinkles everywhere, they're asking for lip fillers. So that's the next. And then if we go to 5, it's the chin, and you're going to see a lot more in chin. Why? A lot more fillers, a lot more devices. Because the chin squares as we age. This is what bothers everyone. If you think of descent tissues, this is what's going to drive you to have a surgical facelift, is mainly this region for many. So, and what's R6? Can you guys guess? We have the shape, we have the eyes, that's 2, 3, 4 is the lips, 5 is the chin, all important. R6, and it's why I have trouble answering some questions that you guys ask. It's motor movement. Well, what I was watching this morning, a business show, and the gal, they have them up on the Zoom now on TV, and there was 3 guys and a gal. The gal looked amazing. She looked good, younger-ish gal, and I'm assessing her face, and then she spoke, and everything went down. It changed the whole perception, and everything that I would have done to her or advised to her, I needed to see the motor movement. The first 3 guys talked, the girl talked last, and it changed everything I was thinking about her facial structure or what I would advise. So that's we're half done, and then we're going to get to your Q&A. I know that's kind of like you have to eat dinner to get the dessert, and I know you're all It's pumpkin pie right now, so we're getting to the pumpkin pie. But here's what goes through the mind of your provider. And I put it as Rajani. It's a mnemonic. So when I'm teaching or to my staff, it's easy. Doctors use mnemonics. It's what we do. But whether you Rajani the patient or not, the provider is doing it without knowing. So R, I have a video on it. R in Rajani, the first R is going to be for request. Okay, so when you walk in, they sit down, and if your provider doesn't do this, you got to run away. But the request is they're asking for information. So what have you done before? What did you like? What didn't? What are your allergies? What's your medical history? A, what are you doing? Assessing. The provider is assessing the face. They're looking at the face and looking at what I just said, the R6, the motor movement, the wrinkles, the folds, the smile lines. Okay, so we have that. The next one, J. Not, especially doctors, we're not good at this. You have to gel with the patient. Why I have patients, I don't think I'm the best in the world at anything, but I gel with my patients because I see people that I like to see. It's like a family of people at my clinic. So you have to gel with the patient. What do they do? Why are they here? Marriage, divorce, wedding, seeing the in-laws. There's a reason they came to your clinic. Instagram queen, whatever it is. So you got to gel. The next A that you're going to see is angles. What we talked about, the facial shape, the cat eye, the nose, how does the jaw fit, the V-line, all the videos I do. And then N in Rajani is negotiate. Now, everyone here, because I know you think everyone's concerned about getting ripped off. And then what I'm telling people is most clinics I go into, they're not there to grab the money. And I know a lot of people think they are. They are there to provide a service and have happy patients. Because the worst thing for clinics is to have unhappy people, unhappy patients, and get those calls. You're negotiating what you're going to do. So the person that wants brand new lips with wrinkles and folds everywhere, they can't have that until you address the more important things and balance it with the lips. Nothing looks worse than brand new lips on an older looking face. So you're negotiating, oh, you want cheek filler all here? It's going to make you look fat. I'll do half here, half high cheek. So I'm negotiating. It's not money. And what everyone wants to learn is the I in Rajani. I is initiating the treatment, but it's the last thing. If you don't get R-A-J-A-N, you never get to inject. But when I walk into a clinic, they want to learn to inject. They might not get there because they don't have the first 5. That's all of my speech today. That's the meal. But I want to set you up for 2021. I want to know what you want to get from this channel. What value am I offering you? So when I look at the videos that we do next year, what I see people wanting to do is, hey, what should I do from the devices? Does this work? Does that work? What am I going to do? So ask me questions. This is your opportunity. Ask me questions that you've been wanting to know, or devices. It's a Sunday. Keep it in my wheelhouse if you can, so I don't have to think so hard. I don't want to think today, but you know I will if you throw something out there. So, you know, that's I think what we look at, and those are the things we're going to look at in the year ahead. So what are the best products to microneedle in? You know, I'm passionate about this because what I worry about with microneedling is that we're putting things in the body with the microneedling. And what happens is people aren't paying attention to the purity. Is it biocompatible? Is it sterile? Is it clean? So the best thing to microneedle is PRF, platelet-rich fibrin, your own body's product. When are you going to share your PRF updates? I'm going to do a video today, if I have time after this. We have PRF-X coming, and we have PRF-F. PRF-X is extended play. So that's a PRF that's going to last you about an hour to 2, and you get more volume. And PRF-F, which is a filler version. Okay, so that's PRF. So when am I sharing them? I'll do the video. It depends when I get to edit it. 2021, we'll teach it on the tour. So yes, we have that coming. It's really cool stuff. I'd like to offer RF microneedling. What machine is best? This is an amazing question. I'm going to answer it directly and succinctly in that this. What do you want to get results from it? What's the results you're looking for? There are three main types. I'm going to go through. Number one are insulated needle types. Would be Lutronic Infinity and the newer Genius, insulated ones. Non-insulated would be some of the older technology. Syneron, I believe it's Syneron, owns the patent to the insulation of the needle. So those who don't pay the patent get the non-insulated needles, or the Na effect, or Dr. Na with the Scarlet, which is another one you hear about. That's non-insulated. That's going to affect the outside of the skin a little more because the needles aren't insulated. So micro needling RF, I think the user is much more important, except, so you got Vivace, Lutronic is great one. I like the Infinity, the new Genius is great. I think you have, when you want to go to the heavy lifting, if your patients are willing to take downtime, then something like the Candela's platform will be deeper, and the dwell time. So the Candela Profound, that can have up to a 3-second dwell time. So if you're trying to get facial fat, that device is, in my opinion, going to get you more. The side effects will be more as well. And that's where it lies. When you ask about microneedling, it's like CO2 laser. It's amazing, but it has to be accepted in your practice. And the user, in many cases, is as important as the device. They have to do hundreds. Okay, Easy PRF machine cost. So I don't sell the machines. There's somewhere between $2,000 and $3,000. You get tubes with them. You make your, they're very cost effective. There's so much up here. I have to talk about PRF. I don't want to bore all the other people who don't want to know about it, but understand your tubes. They could be hydrophilic tubes or hydrophobic. If they're hydrophobic, you're going to get an early clot. If you're spinning a PRF on an angle, you have to know your machine and test for growth factors. If you're spinning sideways, the idea is the white cells, which weigh about the same as the red cells, can then get into the milieu. So it's very particular. If you're trying to make it at home, I have 7 spinners. I'm always playing with things. There's a way to do it. But PRF is, I have to tell you, and as you know, because some people are sick of hearing about plasma skull and PRF, I have more and more PRF in the new protocols I'm using. I'm putting it everywhere, all over the face. It helps the fat get healthy. It helps the face get healthy, and people look younger. It's one of the things I'm most excited about. And if you buy that PRF microneedling device, consider using PRF on top of that when you're done. Do you recommend under eye filler for someone under 30? Are there treatment options, other treatment options? Absolutely. Watch my plasma eyes, especially under 30. Age, there is a genetic component to what you guys call the tear trough. I like calling it the lid cheek junction. So you'll see kids at 17, 18 have that. Hyaluronic acids, they're not terrible. Everyone's scared of them. Why? Because they draw water in. People try and put them in at different depths. They're fraught with problems. Watch my videos on them. But I would, especially the younger person, they'll probably get away with plasma eyes first. And it's way better for me than doing fillers. Doing great on PRF education, Doc. Yes, Jamie, my nurse, is on here. You should be working, Jamie. How come you're not in there working? I love that you're having a great weekend. I'm totally kidding on that, of course. Had to give you trouble. So let's see. Your doctor said threads will show my skin. Aren't there dissolving threads? This doctor I went to said there isn't. Wow. I bite my tongue. You bite your lip or your tongue? What's the saying? I don't even know. In Canada, we say bite the tongue because we're getting hit. We're playing hockey and things. We come off with our tongue hanging off, but bite my lip all the time. People who make these comments on threads and watch my video, I think they call it thread haters or something like that, because they haven't put a thread in a face. They have other agendas, I would say. There's a place for them. People who don't believe or see threads, PDO, polydioxone, PCL, polycaprolactone, and PLLA are all resorbable, produce type 1 and 3 collagen. This whole thing about scar tissue, ask them when they go do a facelift, then, oh, you can't do my facelift because I had threads? Oh, no, we can do it. It's not a problem. Okay, answers your question. So if you have an agenda, you're going to get a different story. I do a lot of threads. Threads are problematic. Threads are great. And threads are in between. It's about patient selection. Skill set is huge on threads. People who train and do a lot of threads are great. So yes, you will not see these threads under the skin unless they're put in, wrong might be the wrong way to put it, but a skillful injector is going to be able to avoid that, yes. And they do dissolve. PDO will dissolve first, next is PLLA, then PCL. I have a whole video on that. Let's see, I just got Belkira on Friday. Very nice. You're Canadian then. I'm pretty bruised and swelled up. How long until this gets back to normal? You know, I have a lot of videos on that and the swelling. When you, for those who don't know, Belkira, Canada, tell me where you're from, because it's the only place I know Belkira is at. Other than, there's no other ones in Canada, but it's for the Europeans out there, phosphatidylcholine and deoxycholate. For the Asians, you have a lot of V-line solutions. That's what we're talking about. Final results are typically, funny enough, 6 months, 4 to 6 months. It takes a while. The swelling, everyone's different. The first time lasts the most, the longest. And for the person looking at themselves, we're more picky when we look at ourselves. And so I would say 2 to 4 weeks of swelling. The bruising certainly in the last 2 weeks. The swelling creates inflammation, which creates some of the tightening. So it's not a bad thing. And each treatment you get is less. Do you have anything?
Oh, yeah, I got another good question.
Oh, good question. Okay.
Someone said, what's your view on jaw filler? And if I did get jaw filler, after it wears off, am I going to get a real big sag in that area, saggy face?
I love your question, but here I got to answer. Kelowna, BC. I want to come up there skiing, Heather. You guys better open up. You know, I'm Canadian too, so I want to come up there. Kelowna is amazing. Yeah, Belkira for sure. So if you get fillers in the face, will it be saggy? This is a great question. It's going to go for everything. And Jamie, my nurse who's on here, she does a lot of jawlines. People love doing jawlines. Okay, so she should be answering this. But when filler goes away, and yes, filler can migrate. Yes, you need some volume. Imagine a jawline. Yes, you need some volume. You do not get saggy skin after unless you put a boggy filler in that draws water, and you can get rid of the filler if you don't want to, but we just don't see it. There's forearm studies done. When you put filler in, it stretches the skin. That stretch produces collagen. And so fillers, and you might say, well, I had them done now, I'm boggy afterwards. I'm not saying anecdotally that might not happen. It's like people say Hylenex took my face away, dissolved my face too. Okay, yes, there's going to be anecdotal reports, but I need to answer for the masses. That means 95% of plus people will not get sagginess after fillers. In fact, they'll look better 5-7 years from now than if they did not. And that's the question. When we study things, the double-blind placebo-controlled trial is number one, but there's no control for this unless you did half a jawline and waited to see 10 years later what the other half did, but we can't do it, and one jawline is different than the other. So these are a lot of things that are not studied. So understand that combining treatments, they're not studied. Plasma pen effective in preventing lines. Wonderful question. Thank you for asking. The plasma pen, and you're getting Rajani's opinion. So I'm not here to offend anyone or the companies that do it. If people like the pen, they have it. It's great. I could care less what you do as long as I'm giving you good information and you're safe for what you want to do. But the plasma pen is something I would never do. I would never offer it. I think it's dangerous. The dwell time that you put that pen on is dependent upon that hand. And the hand is the user. So there's people who can be great with this plasma pen, but the biggest disasters I see are from the plasma pen. When you have other treatments like RF microneedling, when you have things like CO2 lasers, when you have things that are much more predictable, the plasma pen scares me. On this phone in a given day, there's probably 2 or 3 disasters, burns, or different things. So I'm not a plasma pen fan. I do think I'm not throwing it out. I'm saying people need to really be careful with it, use it well. So does it tighten the skin? Sure, it does. A burn will tighten your skin. And I know the plasma is different than forming that plasma is different than just electrical energy. I get it all. So what is the best at-home device? Here's $1 million question for you guys, and this is where you are going to help me. So put in the comments, do you want me to, obviously I'm spread thin because this thing just spins all the time. Do you want home devices covered? Is it something you want to see covered? The best home device, if you're using great skincare with a great galvanic, I like that. When you start to go to things like high frequency ultrasound, RF machines, we'd have to get the machines, measure the energy, measure the consistency, measure the burn rates. It's all about heating the skin. When you start doing that, you better be careful. 42, 43 degrees consistently. Yes, you can get rid of fat. There's about 40 videos I got to make. One of them is getting rid of fat in the face, because you guys always ask. RF can, high frequency ultrasound can. It depends on your provider. So let's see, home. So that's home device. So you guys do want home devices. Okay, I got to get on my. You got to get onto the what would you call it? I guess the subway to China and get them all sent over, because that's where people are buying them from. Do you have something?
Yeah, they asked a question about chin enhancement. What filler would you use?
Chin enhancement. So tomorrow's video. Excellent question. You guys are spot on. Excellent question. Chin enhancement is big. Of course, you have an approval now from what's now AbbVie, which was Allergan, which is Voluma for the chin. And the chin is what? My R5. Remember how important the chin was? Okay. So the best filler has a high G prime in my book. So which ones do I like? Voluma is a good filler for it. I like Restylane Lift. Restylane Define is a good one. Again, you don't want watering, but you want projection. Okay, so that's something for sure to think about. If you want permanent, and you tell me, have you been watching? Volux is good. Sam says yes, I like Volux. If I do not like Ultra Plus for jawlines down here, under eye. For lips, it draws water and it can look good. You don't want it at the border, but I don't like it for the chin. Of course, you're under the muscle, so yeah, you might not see the water as much, but anything boggy down here, we want tight, bright, and firm. So be mindful of that. Bellafill, if you want permanent's a good option. And G Prime, you can't leave out Radius. Radius is the highest G Prime product. If you get an occlusion, if you get a problem, you're kind of up the creek, because I know sodium phosphate, you're going to dissolve it and everything, but it does not dissolve. So keep that in mind. You want to know what you're doing. Best procedure to remove hyperpigmentation due to sun damage. Amazing. Watch and wait, not melasma. So Teresa K, wonderful. She said not melasma. And that's key, because if it's melasma, it can be caused by hormones, by sunlight, by heat, and different things. Melasma is a different animal. So we'll take that out of the equation. You can't beat CO2 laser or IPL. And I know everyone wants skincare. You know I love skincare. But people don't come to see me for skincare. They want boom, boom, result. So those are Erbium Yags. You take halos and different things. Yeah, it's good. I like them. And yes, they have replaced CO2 for most med spas. The difference with the CO2, if you have 2 weeks for downtime for CO2 and you get that, you're going to look better 5 to 10 years from now. That's an aggressive treatment. So the Erbium Yags, like a halo, like a Fraxel 1550, and has a 1920 Fraxel dual, they are great. Less downtime. But understand, and I want you all to understand, you need multiple treatments of things. And I know no one wants to hear that. But if you don't want the downtime, I talked about Profound, the RF microneedling for down the lower face. If you come in and you don't have 7 days where you can have swelling, seeing the little openings, they're 32 gauge needles that go in for 3 seconds of heating. then you're not going to quite get that result than if you just want a day of downtime. So you have to understand your mentation. So yeah, you want home devices too, and Andis wants home devices. Best RF energy for post-acne scars to use in RF microneedling. Okay, your machine goes to 150. So RF microneedling, yes. Again, it's just the machines which are insulated needles. You can go deeper. You can hit them harder with the energy. The user is going to be very important. Again, I think a Lutronic Infinity or Genius is great. The Scarlett's great. The Morpheus is a reasonable device. It was Fractora and now Morpheus. Knowing the depth 3.5 millimeters is a good depth to know. So when you're talking depth, if you got ice pick acne scars, you want to go deeper and hotter, and don't rule out CO2 laser because there's also pigment involved, and you're not going to see a lot of pigment changes with an RF microneedling. What lip filler is the best? It's plasma lip, PRF. So it depends. Do you want all natural? You go that route with a lip enhancer, great. What I've been liking for vertical lines is going up and undermining them with a cannula. With PRF, it works great. If you want volume, pow, you want shape, you want to create changes in distances, Jamie on here will tell you she uses a lot of Define and Restylane Kiss. We like those best. Is there one best? There's no one best. We have our favorites. That's how I look at it. So I like those. If you're in the Juvederm family, Ultra and Ultra Plus are still go-to. And you know what I probably use the most of it? I like Restylane L. I used it since 2003. Buckets of it. So I love it. It's still a great filler. Do I recommend, this is a good one, at home red light therapy devices? Do they work at all? Yes. And I was somewhere a few weeks ago, they put me in that red machine. You put your whole body in there. It takes all your inflammation out. That's the idea. But I'm a fan of red light. I got one back here. It was given to me at a conference, and I used it. I like it. If you have the time for it, yes. Understand, again, what a lot of people need is facial structural volumization, something like Plasma Sculpt, biostimulators, hyperdilute radius, Sculptor would be the best. And I'm sure if there's people from around the world here, you're going to ask me about chopped up PDO or PDO liquid, PLLA liquid, different ones. They're all biostimulators. Yeah, so my boring light loves red light and cold lasers. Perfect. I'm with you. I like it too. So those are some good questions. But that's the thing on lip filler, what I would say. Most importantly, if you watch my videos on lip filler, it's looking at the angles, and I'm excited that the chin approvals are coming forth for these fillers, because you can't do lips without looking at the lower face, the AE line, which I talk about in all my videos, and the chin. You cannot do lip fillers without looking at the chin. It is congruent. What do you do? Another good one, malar edema under the eyes and cheeks. It's fluid, not fat. Complex, very complex. You have lymphatic drainage problems. You have demarcation of the fat pads. Okay, so you have the medial, middle, lateral fat pad, and then deep fat pads. And you have certainly the aging process, and it waxes and wanes based on intake, salt intake, all those things. So tightening the skin, don't mess with them by putting threads through them, things like that. That can be disaster. Radius has carboxymethyl cellulose back in 96, not quite, 2006, when it was first approved. We had some people that got a little reaction to that. I don't recommend that unless you're deep on bone. Don't go superficial with that product there, because it can last 3 months. But RF microneedling works actually very well up there. You have to have good dwell times, deep heating, and you have to have, you're going to be a little baggy for a couple of weeks, but it tightens the tissue, or surgery. Best under eye filler, another one for dark circles. Okay, let's go through the under eye. Well, we don't want it to draw water in. So to me, and I heard someone, you have people comment on their live streams that I think have never injected before. But I heard the other day someone talking, I use Restylane, but I'd never use Lift. Okay. Things like that. I get where you guys are confused because you hear stuff like that. So Restylane L, 450 microns, Lift is the same product, but it's 900 microns. I like Lift. I use it all the time. You can put the cannula indication for Restylane Lift mid-base goes to the bone, which is the under eye. Okay, so you're in an FDA-approved area with an FDA-approved product that doesn't draw water in. So when people say weird, I go, well, you don't do fillers. These people do not do any volume of fillers. So those are two good ones, Restylane, Restylane Lift. If you're on the Allergan side, they said, oh, I would never use Voluma under the eye. Voluma is one of the best products under the eye. If you're not using Restylane products, Voluma under the eye is great. It lasts long, doesn't draw water in. It's the best of the Vycross technology. And of course, watch my Sculptra videos. If you come in up here, 3 no-go zones for Sculptra: the neck, the lips, the under eye. Never put Sculptra there. But when you do my lateral technique on the bone, you're going to get Sculptra under the eye, even though we never put it right there. So those are 3 good things. And then, of course, PRF is key because you have to have good skin if you're going to do fillers under the eye. You don't want to see them. So can molded PDO thread be used to project the chin? That's a great question. And in general, it's not a use. Anything can be done. Can you go drive your car off a cliff? It's not a problem. You go hit the gas pedal, you're gone. Not a good thing. So you can do a lot of things. Would I do it? No. Do I conceptualize? No. The chin, think of a chin implant. Make an opening here. You mold, you put it in, you cut it down, you take it out, you recut it down, you create the chin you want. That's probably 20 to 30, 40 cc's of a product, at least 12, 15 cc's, 15 mLs. Imagine taking a thread. You're not going to create the volume, for one, and you're not going to hold this empty space has to be taken up by something. So you can move the chin backwards, but it's not what most people want. You want a convex face. Face yoga. Very good. Of course, yoga is wonderful. You're going to increase blood flow. You're going to help with some shaping. You're increasing. They've done skincare studies where they put controls in, and what they found is putting a skincare that has nothing in it versus something that has something great in it, or what you guys think is great. Sometimes it's the same, but both improve. Why? Massaging the face in and of itself is excellent. Increase blood flow, increase lymphatic drainage. You're paying attention to your skin now. So all those things improve your skin. So yes, the answer is I'm a big fan of it. If someone comes to see someone like me, the results you're going to get with face yoga is not enough. If you're spending $3 to $5 grand, you want to see something. And where do you get that? Just chin fillers. If you're doing chin and jawline and you use 4 to 5 vials, and you're at just even say $500 a vial, let's say you're somewhere where it isn't that expensive, you're at $2,500. So that's what you got to think about. Do I like PDO threads for teardrops? I do not per se. Of course, I like the plasma best because it's all natural. It looks good. It might avoid me from doing anything. But the one thing is, remember, it's your R2. Your R1 is your face shape. Your R2 is your eyes. You can't dissolve it. If someone doesn't like something in their R2 zone, you're screwed. And for the injectors on here, they'll tell you the most anxiety-provoking patients are their lip patients and their under eye patients, because they call back and they're livid, they're angry, they're upset because they're in 2 focal zones. And if there's a lump or a bump or it doesn't look right, you cannot remove that thread really, because you're talking 29, 28, 27 gauge threads if you're in North America. Over in Korea, you'd be talking bigger threads. Risks are way more tolerated over there. So that's the answer for under eye and the threads. Can they work and do they look good? Yes, I think they can. You just have to know that you want to go down that road of managing expectations and managing side effects. Would I put them in myself? Yeah, not a problem. Certain patients, yes. But as a general rule, I don't do it in practice a lot. What brand of acids go into skin more readily? What brand? That's a great question. I mean, you're talking chemical peels now. I don't have a specific brand. We can talk chemical peels if you want. As you know, I'm not selling you anything. I don't like to be commercial. I don't tell you this brand, that brand. I'm not that. My goal is not to sell you anything, but to give you the information to make the decisions with. So I don't like to talk brands as much unless there's something really to it. Second Botox nose slimmer comment. Oh, what's that mean? Second Botox. So do you want to know if you can use Botox to slim the nose? You can use it to help upturn the nose. It's not that the upturned nose. So this is called the what you're talking about is the nasolabial angle. This is the fold, and this is the angle. And people want that nose that's buttoned or to upturn. That angle, that's what we're talking about. So Botox can work. It's the nasal muscle at the base that you're treating that pulls it down. As much as that's strong, so if it's strong and you treat it, yes, it will stop pulling you again, upturn the nose. Not something I do all the time. If you have nasal show from the side and the columella is not hanging, now you can put PDO threads right through the piriform aperture. They have to be about 18 gauge, but they look good. Or you can fill it for the tip. But I'm not a huge fan of Botox for the nose. No. Pore size, yes, on the nose. What's the best preventive care for a younger person? Number one, you go live your life. You are young and you're youthful. Decrease stress, live a healthy life, use your sunscreen, vitamin C, and your retinoics. That's the answer to that, and enjoy life. What's the most effective injection site to achieve lateral brow lift with Botox? Nice, easy question. The downward fibers of the orbicularis oculi. So it's right at lateral at the brow, and that will stop the downward pull, and you get the upward pull. Probably the brow and Botox type products, Botox, Jeuveau, Xeomin, Dysport, those are all ones in North America, particularly USA. There's different ones in Canada. And Mexico is part of North America. Don't forget our Mexican friends. But so when you're using those products, people always think if you inject the forehead, you're going to get a lift. It's misunderstood. And people with brow droops, all the time, people will send me questions to this phone and say, hey, I droop, and they're livid at that they droop. Not my patients, thankfully, all the time. Have I drew people? Of course. I keep going to the 1990s, but 2002 to 2006, our average dose for a forehead, pretty much everyone, men and women, I was using 20 units. People didn't call me back upset back then. One, there was no Facebook or all that stuff. All those reviews didn't exist. They didn't care. They wanted a smooth forehead. We weren't attuned to the brow. Doc, I want more in the forehead. And they were drooping. It was acceptable back then. Not the lid droop, but the brow droop. Now everyone wants the Bella Hadid lift. So they're attuned to it. How to avoid blindness when doing under eye fillers. It's a Sunday morning and you guys want to go there. Let's go to blindness. Okay, little coffee juice before we hit this. Blindness can occur with anything. Here's two things that will scare you. Injection of a steroid for dermatological reasons in the ear created blindness. An injection of lidocaine with epinephrine has caused blindness. So lidocaine, that's a numbing solution with epinephrine, contracts the vessel, went to the retinal artery. We do this all the time. We put tons of lidocaine in faces, and lidocaine with epi cause blindness. Anything can create blindness. It's a blanket statement, okay? But so with fillers, how do you prevent it? A, there's just bad luck. B, injecting small amounts, either A, very superficial, B, very deep. Microcannulas help a little bit. But really, a skilled provider can get blindness. There's no question. Do I worry about it? Every day I worry about it. If your injector doesn't worry about it, then you should be worried. I'm nervous every time I do anything. I inject anything. That's a healthy nervousness. But I also, as you know, do a lot of Sculptra in the areas that are dangerous. Not the direct under eye, but around that area. Sculptra's of water. I can pull back. For me, I like seeing what might be in the syringe. If it's blood, I will see it. With a filler, when you pull back, you might not see it. So it's unreliable. So how do you avoid it? Those are the things. Be careful not injecting too much, not being in the in-between layers. Understand it can happen. And here's the other thing. What is the risk? The risk is quoted around 1 in 10,000 to 1 in 100,000 injections. That's rare, rare, rare. People took more risk getting to my office than they're taking being in my office. So if you want zero risk life, or it doesn't mean that much, then to take that risk, then do it. And if you want no risk, don't do it. And plasma, the PRF, it's one of the reasons I do PRF. There's never been a reported case of PRF and blindness. It's your own blood product. I believe it can occur. I just don't think that it's common. It's less common. At least it's your own product. But I treat it like it could. Profilo. Patient had Profilo in my under eye to get rid of dark circles. Now I have under eye bags. Was it too much product? I do not react properly to this product. Nuttization. I love seeing your guys' tags names. Nuttization. Okay. You guys know what Profilo is? The Americanos don't. Profilo, mainly in Europe, it's built, invented, manufactured, we'll say built. It's built in Italy. And it is a hyaluronic acid, not cross-link like the ones we have here in the United States. And what it does, it's held together by charges. That's what they say. So that's what keeps it cohesive. You inject it 3 sessions, a couple of mLs in certain points. I think there's 5 points on each side of the face is how it's supposed to be used. And you spread it everywhere. That should last in your body for about 6 weeks and should be gone. Theoretically, you can dissolve with Hylenex, hyaluronic days. So can it cause dark circles? Anything can happen, and you can get pigmentation from the inflammation that anything caused, likely Profilo too. But yes, so Profilo, great question on that. How deep do you inject PRF under the eye, Mina? Okay, so the whole new protocol is coming for PRF, and I'm trying to get a hold of some really cool things so we can do more. Micro cannula, large gauge, 25 gauge. You want to use a 22, that's fine. Depends what you're trying to do. And the beauty with PRF is if people come in and the eye looks perfect, but they got some lines on the lid and lower, you can inject it superficially. You're not going to have problems with superficial PRF in terms of visibility, but it's a skin tightener. I want to say one more thing after that, so stay tuned on the PRF. So superficial, if they need volume, you go, I've been going more and more deep underneath orbicularis oculi, 1 strip, above 1 strip. Here's the thing, with our new protocols, we get twice as much PRF. It lasts for up to 2 hours. I'll reveal those to you 2021, and I'll talk a little bit about YouTube through Christmas on it. However, I'm injecting more throughout the face. I think what we're doing, we knew it with the under eye. We're at almost 5,000 eyes now for me, for just myself and my practice, our staff. So pretty amazing amounts. One thing to think about with PRF, people tell you the spinner needs to be like this, the tubes need to be like this. And then you ask, oh, how many patients you've injected? Oh, I haven't injected any patients. So it's not just what you're getting. Yes, it's important. What's the fibrin percentage? What's the platelet concentration? Are there leukocytes? All those are important. But if you can't clinically show me 100 or 1,000 patients that you've done, that you've seen results, it's all for naught. You're pontificating about science. So keep that in mind when you're hearing your PRF gurus. Are they injecting it into faces? I have more, so I'm putting it all over the face. What I'm seeing is fat getting healthy, glow, vibrance, and it all makes sense. So when we come up with when I talk to you about the PRFF, which is a PRF filler, how we're making that, when we do that into the new year, we'll talk about it. Pretty exciting stuff. I don't look at it as like a filler, but a biostimulator of your own body for the face. So if you're a PRF guru, you want to do PRF, you can make a whole clinic, never do fillers, I believe, and you could do PRF and make a great living. Okay, what happens if your PDO threads are expired in 3 months? You can still use them, or should 1 year before you use them? I can't tell you to use expired stuff. What I can tell you is when they're exposed to oxygen, particularly PDO, they crumble. And the problem with people getting all the threads, and a lot of people buying threads, the do-it-yourselfers and everything, what you'll find, you ask them, the tensile strength is gone, and oh, they didn't work. Oh, or people got threads. Oh, I had a thread lift, didn't work. Well, how old were the threads? What were they? What type were they? I like to use FDA-approved product, fresh, everything, fresh, everything. Then the result doesn't occur. It's either because something's wrong with the patient. We'll always blame something on the patient, but the patient didn't respond in some way, or it's my fault. So I don't want the product to ever be the variable, although by nature, some products do have a variable. In that case, something expired like that. Why take that variable into your equation of something that is a variable, which is a set of treatments? There's variability. What do I think about Kybella? Love it, of course. Effortlessly Egypt. That's a hard one. Girl, looks like a gal. So effortlessly. So I don't know what you have over there, but I like it. Dissolves the fat. There is some swelling. You have to do multiple treatments. In North America, Belcura too, but also the United States, I think it's expensive. So if you're willing to pay for it, great. I know Asia, you find it like coffee shops. Okay, so it's much less expensive. Question?
Barbara Robinson asked,
Okay.
best treatment for treating the forehead. Botox doesn't work well anymore.
Great question. So the forehead, what is the best treatment for the forehead is what we're asking. Botox doesn't work anymore. Loaded question on two sides. Number one, you see these things on binding proteins. People talk about them like this is it. It's the binding protein. You get Xeomin, there's no binding proteins, and now it's going to work. It's a great story. It's good to know. It's science. We all look at it, but it's not that cut and dry. So yes, I do believe Xeomin plays a role. Yes, there are no binding proteins, 150 micron molecule, 150 nanograms. And then you get up to Botox, which you get, which is 950, kilodaltons. And so and Dysport has half of that in binding proteins. What role do they play? We're not sure. So is it working? Number one, if you've tried one toxin, try a different one. I often start with Dysport and move around from there if needed. Dysport has a lot of active product in it. And so that's one thing, switching toxins. However, after the age of 45, 50, this isn't good to do anyway. So you want movement so that it lifts your eyes so we don't fall. So RF microneedling's great. There's not a lot of fat up here. The settings have to be perfect because you don't want to get rid of fat. So low energy, superficial settings, not a lot of time. The time seems to be important with the RF and fat loss. Okay, so RF microneedling is great. If you want to do what I call plasma glow, which is PRF in microneedling, you have to have a little more patience. Your skin should be in a little better shape. So you don't need as much oomph like you would the microneedling with RF is going to get you. That's going to be good. Retinols, retinoics. We don't fill foreheads mainly because there's communicating vessels. I've done them and I've done Sculptra and people overseas, Asia, it's common, but there's communicating vessels from the veins to the arteries, particularly in the brow and above. That means it communicates to the retinal artery. And that means you don't see anymore. So in terms of blindness, and so I don't like filling foreheads. And if there's certain planes that if you're going to do it, you better be in. So platysma bands showing off the neck. If I want longer result that Botox offers, will a PDO thread lift give good results, or do I have to get a platysmoplasty? Number one, the gold standard is going to be a platysmoplasty. If you have a band that's showing, that's deep. Now, of course, you might have a minor one. I have people come in and they go, I got this big neck band. What do I do about it? And I look and I need a microscope. A little bit of Botox, a little bit of Dysport, they're done, they're fine. Okay. RF microneedling, great, tightens the skin, does well. If you have a hanging band, if you look at some of our coming in presidents and going out presidents, hanging bands, that's surgical. So I don't know when you ask me how deep it is, but surgery's gold standard. You use toxin, tightening the skin, PDO threads work well, but the tissue has to go somewhere. So submentally is where I like to use them, and lift. PDO threads do not get rid of fat. I know people start talking about they cause fat loss. We're looking into that. That's something that's being studied, but you can't say that at this time. What's my opinion on people doing their own PDO threads? It's like saying, my neighbor's going out to play golf. Do I care? I don't care. Why would I care? I care because if they're people I know, love, and my patients who I love, of course, I need to have a chat with them. I want them to look good. I have a vested interest. If someone's doing PDO threads and they're happy and they're doing it at home, what they're doing, I don't personally have a stake in that. If you want to do them, you get good results, whatever. I'm not the thread police or the aesthetic police. What I do is provide what I believe to be excellent, safe treatments for those people that want to come to an expert. When I say I'm an expert because I believe that I'm educating myself, that I care about my patients, and I'm giving them the highest level that I can offer them. And I also send them to get other things if I don't offer what they need. That's what you're looking for, in my opinion. It's what I would want if I went to a clinic. So yeah, if you want to do your own threads, it's very hard. I did talk to a doctor the other day, did his own barb. Very hard to go and do a proper molded thread on yourself. So, question?
Best neurotox location for getting an upturned lip corner.
Upturned lip corner. Very important. And the reason is, if the mouth is turning down, you're perceived to be angry, untoward, unapproachable. And if you're in business and you're making 200 grand a year and the mouth's turning down, you're now making 100 grand a year. So a funny story, when I started doing this in 2000, whatever it was, long ago, over 20 years ago, I had a guy come from a car dealership, and he came in, male patient, kind of rare at that time, 20 some years ago. And I treated his frown, and all of a sudden I had like 7 of them come in who knew him, men. And I was like, what are you guys here? Oh, so-and-so came and they got their neuromodulator here, and they're selling like 5 times, no, that's exaggerated, a lot more cars than they normally sell. And they realized that if they weren't frowning, their sales went way up. And it was all new to me. We were all learning. We're like, wow, we're saving marriages and people are making more money. Because when you see someone untoward, you don't want to talk to them. So the upturn of the mouth, DAO, if it's strong, you treat the DAO, triangular muscle, and it helps lift up. But a lot of times you need filler too. And a lot of times you need a lifting thread too, depending, how much drooping you have. And I will throw in there Kybella, RF microneedling, whatever, to dissolve the fat at the edge of the mouth. And most people, even if they don't want lip volume, lose volume at the edge of the lip. And what happens then, if they lose that, the mouth turns down. So often it is neuromodulator like Botox Dysport, filler at the edge, a thread, dissolving, and lip filler. So you see where combinations come in, because a few small things look way better than a lot of one thing. And if you have one tool in your toolbox, you're never going to be able to create that result than someone that has 5 or 6 and knows how to use them. This is good. I think it's going to be good. Will hyaluronidase injection in the under cheek part also reduce volume in the middle of the cheek? Now, people ask me, and there are people, and someone the other day, we were talking back and forth. I love it. I like talking to people. Said, hey, Hylenex, look on RealSelf. All the people have been botched or maimed by Hylenex and hyaluronidase. And I just said, send me any data. And here's why. It's a dispersant. Yes, precision's tricky. If you're an ocular surgeon, you're using hundreds of units to disperse around the eye, your lidocaine or your numbing. Those people in hundreds of units have not lost volume. Temporarily maybe, but it comes back. You make your own hyaluronic acid and you break it down regularly. Now, we now use hundreds and hundreds of units when we get an occlusion. Those people do not lose fat. I've used it for 20 years. I've never seen fat loss. Why you're seeing, could it happen in some people? Maybe. I've never seen anyone a legitimate case where they say, okay, here it is, and it's from this. But here's why you see it. I get my under eye filled. Why? Because I need it filled. Great. I come back, I go, I'm unhappy. I see it doesn't look good. Now you dissolve me. Now I like some of that filler, but it wasn't perfect. Now my under eye looks the same, maybe even worse, because now it's 4 months later. I've aged. I had fluid under there. I started off with an eye I didn't like. You dissolved it. I really don't like it now. So what I see mostly is people who already didn't look good, had it filled to look good, took it away, and now don't like it. So it's easy to blame it on the Hylenex or hyaluronidase. And I do know there's a study out there talking about it. As far as I can tell, I perused it, looked to be a bit of, I don't want to say garbage, but not enough to say that that's what's happening. You obviously, we want double-blind, placebo-controlled trial. You're not going to get that, but you need at least case reports that are medical with before and afters. Okay. Favorite treatment for hair loss? PRF with A-cell. Easy answer. If you're not going to get FUE, follicular unit extraction. Depends what's causing the hair loss. Yes, very true. It's a great point. Blood work, hormones, all those things need to be known first. But if we're just saying it's hair loss, it's already been worked up. Let's go there. So question.
We're almost at 12 o'clock. So
Yes.
An hour in.
Okay, we got a few minutes left.
One other question was, I've seen facial filler look really harsh. Why?
Yeah. Facial filler look harsh. Many reasons. You could say how long out was it, how much was put in, what was the filler. A lot of people don't know what they're getting. Things can look, if they're in the wrong plane, not good over the years. Belaville is a great product, has to be put in the right way. As we age, the face changes. Might not look good if it wasn't put in properly. A bioalchemate, if you're the Italians or some of the Europeans, or something like, when I hear harsh, I'm also thinking something like silicone. Some people use it, some people like it. Cannot look good as we age. The nice thing, if you're using hyaluronic acid fillers, it's easy. You simply dissolve it, and then you start over. Looking harsh could be many things. People would say Bella Hadid looks harsh with that cheek she has, and the hollow in the buccal area. Is that harsh or is it angular? So we want that high cheek to look harsh. So I don't know what harsh means, but I'm surmising what you're trying to say. Putting in hyaluronidase with Kybella give a better result. There's no studies, zero on it. Don't mess with success. If you want to put a little lidocaine in it, go for it. But other than that, don't mess with success. What's success? Deoxycholate and phosphatidylcholine we used 20 years ago in bucketfuls. Many people have. And I went to learn in France. Pistor is your man to look up for mesotherapy. He did many things, but PCDC was a combination we used for those in America that are older than the age of 40, 45. You'll remember lipodissolve. That's what we're talking. We did at that time add vitamin B to it, carnitine for skin tightening. We added a bit of lidocaine to it. And there's one more thing. I'll have to think of what we added to it. But I don't believe it'll harm it, but there's no evidence on it. Is PRF filler under the eye the best treatment? For who? This is Nadia asks. I can't think of anyone getting filler in my clinic that does not get PRF. In other words, if you're getting filler under the eye, you're going to get at least one session of PRF because the skin has to look great. And if you can avoid getting filler, you should. So you should avoid it. Okay.
One last question, and
Yeah.
then we're gonna wrap it up.
Okay, great.
What is good for hands? Fillers?
Hands, it's surprising. Hands are, people seek out hands. If you're going to do hands, there's three main things that I like to use. Number one, wrestle and lift if you want a hyaluronic acid. Number two, radius. I always thought radius looked good. It's approved in the hands for quite a while. Number three, if you want permanent, I do like Bellafill in the hands. It looks good. It lasts long. So those are the three. Of course, you can do peels. You can do IPL on the hands. You can do CO2, not so much on the hands. So those are things that you can do.
Last question. When are you going to do this?
Bonus question.
When are you going to do the slide?
So here's the thing. I want to know, I'm setting up 2021. I want to know what gives you guys the most value. So what would help me? Anywhere you put comments on the videos that you watch, if you want to let me know somewhere or on my community section, what is it you want to see in 2021? Let me tell you what I think, and you tell me if I'm wrong. How's that? Since I have the stage and I can't fully hear everyone, you can write to me. But what I believe people want from what I see is you guys want to know what to do next. You don't want to be ripped off. You don't want to lose money, and you want to get the results that you were told. I'm summarizing, but that's kind of what I see. It saddens me a little bit. I know that certainly some people feel like they're ripped off sometimes, and oftentimes it's the nature of aesthetics that you need to try a few different things. You need a few different sessions, and this stuff isn't cheap. It has a price to it. So I know those are confounding variables, but if that's what you want to see, that's how we're going to direct the channel. Because that's what I see as a problem within the industries. People don't know what to do when. Part of the problem with me is that question is PRF under the eye the best thing? I really can't answer that until I see the eye. I would love to say yes, no, but I end up saying maybe to 90% of stuff because I can't see the under eye. It could be surgery, it could be filler, it could be PRF, it could be sculpt or high cheek. So there's my limitations. I want to thank everyone. The most important thing to me is you, is our family here, is what you've given me over the years and the feedback and all I learned from everyone here and the fun I have with this. So I want to thank you. Have a great rest of your weekend. I look forward to making you more videos and hopefully share these, if you will, with friends. That's the most important thing because we can grow as a great family of people sharing our ideas, getting great results. But as we grow, there's more people to help us grow, and there's more I can do. There's more demos I can do. There's more companies we can bring in and test things. There's all kinds of fun ideas, but it's all about the audience. So please share them. Have a super rest of your weekend. Go have a fun day. Live life, and I'll see you on YouTube here. We'll do another one of these in the next few weeks. Thank you.